Welcome. My name is Nina Justiniano. I'm the Director of TIA Allied Health. And this is Mrs. Maneve Simon, RN, Nurse Practitioner. And we're going to demonstrate the catheter care that's required, one of the 22 skills that you must master to get your CNA certification. But before I start the skill, I would like to explain some of the catheters that you're going to be using in your career. Please be advised that only an RN or a doctor can insert a catheter. Your job is to keep the catheter clean. That's what the CNA does. So let us begin with the catheters. Some of the equipment that we need is a washcloth, a basin with some warm water, soap, gloves, a towel. Okay? These are some of the catheters that you might use in your nursing career, so you need to be aware of them. This is called a Credé catheter. This is used for a man who has an enlarged prostate. If you use a regular catheter, it will not pass. This catheter is a three-way catheter. If you notice, it has two ports. One port is for the drainage bag, and the other port is for the irrigation that's going to irrigate the man's bladder after the procedure called a TURP, transurethral resection. And our final catheter is a straight catheter. It has no balloon. It goes into the bladder, it drains the bladder completely, and that catheter is removed. And now this is our standard Foley catheter. If you notice, it tells you the size. This is a 14 French. They come 0 up to maybe a size 23. And it also tells you how much water needs to be put into the balloon to inflate it. It says 10 milliliters. I'm going to show you how the catheter is kept in the bladder. The nurse or the doctor inserts the solution of sterile water into the bladder, and there is your balloon. This balloon keeps the catheter inside the bladder where it does not slide out. To remove it, you must get a syringe, a 10 cc syringe, like so, and you put it here, and you withdraw all the solution until the balloon is flat and it slides out without any discomfort for our patient. So now we're going to start our procedure. Okay? Mrs. Simon is going to knock on the door. She's going to introduce herself. She's going to say hand washing required. She's going to check the patient's ID. She's going to provide safety by locking the bed. She's going to provide privacy by closing the privacy curtain. But please be advised that for the state boards, you must touch the curtain to provide privacy. All right? So we're going to proceed. She knocks on the door. Come in.
Good afternoon, Mrs. John. My name is Maneve Simon. I'm going to be your CNA for today. I need to provide Foley care. Is that okay for you?
Yes, it's okay. So she's going to check the ID. She's going to say hand washing required.
John, hand washing required.
She's going to lock her bed. And she's going to provide privacy.
I'm going to provide privacy for
Okay.
Mrs. John.
Now she has her gloves. For this video, we're using the 4-corner technique. This is your washcloth. You're going to fold it in half, and then you're going to fold it in half again, and that provides you with 4 surfaces of cleaning area. 1, 2, 3, 4. Please be advised that Mrs. Simon is going to put soap, no soap, and soap for this procedure. Mrs. Simon is going to have the patient or resident check the temperature of the water for comfort.
Temperature okay?
It's fine. She may proceed with the catheter care. Please, soap, no soap, and soap. Okay. She's going to put her towel over the resident's perineal area. We always go from clean to dirty. So she's going to start with the inner labia going in a downward from back to front. Mrs. Simon now is raising the head of the bed and the bed to provide comfort so she does not injure herself doing the care. She's going from down, from front to back. Wash, rinse, opposite side, wash, rinse, and now she must do the outer labors, which requires soap, no soap, and soap. She's going to clean the outside. Wash, rinse. She's going to go here. Wash, rinse. Now she's going to clean the catheter. Please be advised, nurses, that infections for catheters are ascending, which means the infection is going to go up into our resident. Mrs. Simon is going to go down. She's going to go around and down 3 inches, being careful not to pull on the catheter. Wash, rinse. Wash, rinse. And once again, wash and rinse. Now she's going to pat dry. It's not necessary to wash the patient's buttocks because she was not laying in urine. But we must leave our patient on a dry pad. So Mrs. Simon is going to get a dry pad, and she's going to change the blue pad.
Put your hands, we're going to turn you.
She's turning her comfortably, and now she's placing the blue pad, the fresh, clean, dry blue pad under our resident patient. Okay. Mrs. Simon is going to walk around her bed, and she's going to remove the dirty pad from this side.
I'll turn you to the side. Are you comfortable?
Yes, I'm comfortable. Mrs. Simon now is going to discard her blue pad, her dirty pad. She's going to put any towels and washcloths in our dirty clothes hamper. She's going to empty her basin and dry it out and put it in an appropriate place, which is the bedside stand. Mrs. Simon now is going to remove her gloves, give the patient the core light, ask the patient if she needs anything, and that will be the completion of our skill.
Hand washing required.
She's going to get the core light.
It's the core belt. I'm going to put the leg down. Now, Mrs. John, would you like the curtain open or closed?
Open, please.
Okay, it is locked.
That is the end of our skill. Thank you.